Thank you so much for speaking with us on Health News.
Thank you.
It's the news all over town now is Ebola, and a whole lot of things, information, reaction that people have attached to this. Tell us, what makes this Ebola virus different from the others?
Ebola virus is a highly contagious virus. It's highly infectious, and the mortality rate is extremely high. It's between 50 and 90%. That is the case fatality rate. That is, for those who are infected, the likelihood of dying is between 50 and 90%. It's also a virus of the RNA family, which is one of the most dangerous family of viruses that we have in existence. It multiplies rapidly. It could stay alive in the hosts even when they are dead for a period of days. And whoever comes in contact with the fluid from those hosts will get infected with the virus.
There's really panic in the air. A whole lot of people explaining the Ebola virus in different ways, saying, okay, some people are even as much as afraid to shake hands with others because they think that shaking hands, you really can contract the virus even when the person is not sick. So tell us really about the transmission mode.
The virus we know is a contagious virus from non-human hosts. For example, the food bats have been a major culprit in the transmission of Ebola virus. We have the chimpanzees, we have the monkeys also, serving as a means by which it is being transmitted to humans. But once an human gets infected, then there is always human-to-human transmission of the virus, depending on the state that individual is. Incubation period for the virus is between 2 and 21 days. So at about the 8th, 9th, 10th, 11th day, when the signs of Ebola becomes obvious, then that person is highly infectious. So when you have contact with the body fluids of such individuals, then you could be infected.
Okay, what I'm getting at is, when the virus, for instance, gets into an individual and the person is not having the fever, is not having the headaches, is not vomiting, is it contagious at that point?
At that point, it's not infectious because the virus is still trying to take charge of the host mechanism to make more copies of the virus. So at that period, the person is not infectious.
Thankfully, we have some people who, yes, they've been confirmed with the Ebola virus here in Lagos, but they are receiving treatment. What kind of treatments are you giving at this point?
All they are receiving is palliative treatment to replace the lost fluid, replace the lost electrolyte, and treat other secondary infections that might come in. As you know, there is no treatment for the virus itself, for the Ebola disease. So what they do is just to rehydrate the patient back and get back the lost electrolyte into the patient. And for those, before you begin to see hemorrhage, it's because of those lost in electrolytes, imbalance in those individuals that brings about every other symptoms. So once you rehydrate the patients, which is the major treatment they are being given at Mainland Hospital at the moment, it helps the individual to recuperate.
Of course, some people who had primary contact with late Mr. Sawyer, it's already over 21 days now. Is the danger period over?
For those who have had contact with him since the first day he came into Nigeria, and by now they don't have any signs or symptoms, they are expected to be discharged from the hospital because they are not supposed to be in quarantine at this point in time. But for those who have shown slight signs and symptoms, they will still need to be monitored further.
Okay, and for those who have been confirmed to have the disease, what is their survival rate like?
The chances is high now since they have not progressed. Usually in EVD disease, which is Ebola virus disease, the chances of developing hemorrhage is within the 30% of those patients. But for those who are detected early, the chances of survival is usually very high. Not the best thing for those who have had contact is to present themselves, to come back. If you have signs, headache 2-3 days, that is above 38.7% degrees centigrade, the best you could do for yourself is to present yourself and your contacts to the hospital for you to be monitored. Early detection will save life. But by the time you progress to the later phase of the disease, the likelihood of survival is very, very rare. And you saw the issue with the nurse that passed on.
What really happened with the nurse?
It was a late presentation because he didn't come to the hospital on time.
Okay.
By the time she was coming, she started having hemorrhage and the rest like that. And it's become more difficult for you to manage when hemorrhage have set in.
Why is it that scientists have not been able to find a vaccine for this Ebola virus disease?
I earlier said that Ebola virus is an RNA virus, and the same issue that is existing with HIV, that we have not been able to get a vaccine, is the same thing that cuts across all RNA viruses. They have a system by which they change, they mutate. So what you see today might not be what you are going to see tomorrow. There have been some changes in the gene of that virus that makes them to be elusive. That's the issue with developing a vaccine for Ebola virus, and majorly all RNA viruses.
What would you say that the scientists in the US did with ZMapp? Do you have any idea as to how they came about that serum?
The serum is from somebody that recovered from Ebola infection. And the process they took to get to that stage, I'm not fully aware of that. But what we hear from the internet is that it was a serum from those who have had Ebola infection. At least once you are infected, it is natural for your body to produce antibody against such infection. And once your body is able to overpower that infecting agent, it means you are immune to that particular agent. So they will take blood and purify it and brings out the antibody containing a component. Is what we call antisera. And you can use, if it's purified, to make sure that it is only the antibody for Ebola or any other agent that is in it. You remove all impurities. You make sure there are no other infectious agents in the particular antisera you are giving out. And that will just help to bring down the level of the virus in any individual being infected with the virus before your body will begin to produce its own antibody. That's the principle behind the ZMapp they are using.
Can Nigeria also do this?
Yes, we can. Once we have survival from the episode that we have, then the anti-serum from those survivors could also be developed, purified, and we can use, but it is highly technical that we need to have some expertise in that field.
How soon do you think this is going to leave us alone in Nigeria?
By God's grace, very soon, because the Ministry of Health is working around the clock. The contact tracing is very, very potent, and isolation wards is being constructed all over the country. There was in the news yesterday about the one in Ibadan, and we heard of Bayelsa also talking about bringing 100 and something isolation wards to prepare for an outbreak if it's happened in each of those states.
But we are not looking forward to having more people come down with this virus.
No, we are not. We
Thank you
hope
so much.
the one in Lagos will be contained.
Thank you so much for your time.
Thank you very much.